Okay. Good afternoon, folks, and thank you for joining the webinar. My name is Hank Rosen, and I'm with the Council of State Governments Justice Center. Before we begin, I'd like to briefly talk through a couple of house cleaning items about how the webinar is going to work, and then take a brief moment to tell you a little bit about the National Reentry Resource Center. And during this webinar, you can ask questions by typing it into the Q panel at the bottom right-hand portion of your screen. We will keep a running list of content-related questions that we receive, and then ask the panelists to respond during questions during the last segment of the webinar. We will do our best to get through as many questions as possible, but as you know, there are quite a few people here, and so it may be difficult to parse through them all. If you encounter technical or audio problems during this webinar, please call WebEx technical support at 1-866-293239. Please know that there are some technical issues that you may not be able to resolve. For this reason, we are recording this event and will post it on our website at www.nationalreentryresourcecenter.org. We have the webinar posted early next week, and when it has been posted, we will email everyone a link to the recording. The Reentry Resource Center is now in its third year, and it was established by the Second Chance Act to provide education, training, and technical assistance to states, tribes, territories, local governments, service providers, non-organizations, and institutes working on prisoner reentry. The Resource Center is administered by the Council of State Governments in partnership with the Bureau of Justice Assistance, U.S. Department of Justice. As you can see, this is a snapshot of the National Reentry Resource Center's homepage. We are currently adding new content and resources to our website, and we send out monthly newsletters that provide information about the latest research, funding opportunities, distance learning events like this webinar, and other news and reentry. To sign up for the newsletter, please visit www.nationalreentryresourcecenter.org after today's webinar and sign up for a newsletter in the top left-hand corner as indicated in the screenshot. Our presenters for today's webinar are going to be myself, Hank Rosen, Dr. Nancy Levine, and Hannah Dodd, both from the Urban Institute. Dr. Levine is the director of the Justice Policy Center at the Urban Institute, where he leads a staff of over 3 dozen researchers and oversees a research portfolio of 50 active projects spanning a wide array of crime, justice, and public safety topics. Before being appointed as director, Dr. Levine served for 8 years as a senior research associate at the Institute, directing projects on prisoner reentry, crime prevention, and the evaluation of criminal justice technologies. Prior to the Urban Institute, Dr. Levine was a founding member of the Crime Mapping Research Center, in the Mapping and Analysis for Public Safety program at the National Institute of Justice, the Research, Technology, and Evaluation arm of the U.S. Department of Justice. She served as a special assistant to the Assistant Attorney General for the Office of Justice Programs within DOJ. She has positions as Research Director for the Texas Sentencing Commission, Fellow at the Police Executive Research Forum, and consulted the National Council on Crime and Delinquency. Research interests focus on crime, criminal justice, evaluation, prisoner reentry, crime prevention, and the spatial analysis of crime and criminal behavior. She has published widely on these topics, appearing in a variety of scholarly journals and practitioner publications. Our presenter, Hannah Dodd, is a research associate with the Urban Institute's Justice Policy Center, where research focuses primarily on reentry from incarceration. She works as a project director for the What Works in Reentry website for the National Reentry Resource Center, which will offer policymakers and practitioners clear assessments of the research evidence for a variety of programs and practices. Ms. Dodd also provides technical assistance on jail reentry to local communities as part of the Transition from Jail to Community initiative, for which serves as a project manager, and she has co-authored a toolkit on jail reentry initiatives for local elected officials. For 3 years at the Urban Institute, Ms. Dodd has also been involved with tribal justice, human trafficking, workforce alignment, and responsible fatherhood. Ms. Dodd graduated summa cum laude with a bachelor's degree in sociology and psychology from the College of William and Mary. I work primarily with the Reentry Project team here at the Council of State Governments, helping coordinate and deliver technical assistance to Chance Act grantees through the Bureau of Justice Assistance National Reentry Resource Center. I work directly with grantees so they work to implement successful reentry programs. I also spend part of my time working on the Consent Project and overlapping projects. I also help manage the What Works in Reentry Clearinghouse effort on our end, and likewise coordinate special projects in the focus areas of evaluation and So with that, I'd like to now turn it over to Dr. Levine, who will give a bit of information about what we will be talking about today.
Thank you, Hank, and good afternoon, everybody. What we're talking about today is our What Works in Reentry Clearinghouse. As you probably are all well aware, this is an online searchable website. We're going to tell you a little bit about why we developed this web resource, the methodology behind it, and then Hank's going to give you a tour of it so that you can be well-positioned to go and play around with it on your own and see how you can use it to help enhance the work that you do. So why did we set out to do this project? Well, as you're probably aware, this effort is led by the National Reentry Resource Center, which is run by the Council of State Governments Justice Center. And when they were first established, it was to support Second Chance Act grantees and others across the country who aspire to be grantees or who aspire to develop programs to support the successful reintegration of prisoners and jail inmates back into the community. So looking at developing resources that would serve this audience, the Council of State Governments partnered with the Urban Institute because one major gap that we identified in the field was really accessible information about what works. Now that a lot of people talk about engaging in evidence-based practice, but it was our observation that it was very difficult for practitioners and others in the criminal justice community and their partners to really know what evidence is, how to decipher the research, how to make sense of it. Often there's a lot of information out there, but it's buried in academic journals rather than consolidated in one place. And it's very difficult unless you're an expert, a social scientist with a lot of training to even understand if what research is out there is truly reliable and credible. So that's what we set out to do. We set out to cull all the research available. This is just a great example of how inaccessible a lot of research findings are that appear in academic journals. I'm sure this graph has a lot of meaning to people who know statistics, but for a regular audience, they'd say, what the heck? And so we were trying to get that information in a way that could be usable. So what we set out to do was to first identify all the reentry studies that called themselves evaluations through a review of the literature, and Hannah will explain more what that process was like in a moment. But we identified all the studies out there, and then we screened them out based on ones that met certain standards of rigor, based on our knowledge of evaluation methodologies. Then we coded the studies that we determined were eligible and met that threshold of rigor, and then rated them according to what their findings were, as well as how the quality of the actual research. And then we summarized each of the studies and then synthesized them across common topic areas. So, for example, this is where we are to date. So far, we've identified over 2,500 patients that call themselves evaluations of reentry. Now, I say call themselves that because some of them use the word evaluation, but they're not exactly that, and that actually leads to a reason why many of them are screened out. Either they're not really looking at reentry outcomes, such as recidivism, employment, and so forth, or they're not looking at a population that's exiting prison or jail and returning to the community. They're not evaluative, as I said already. They may use only qualitative methods, which we do see value in, but in the absence of quantitative methods, they don't themselves to rigorous review and synthesis that we set out to do. And some of them were just meta-analyses of other studies, and those are important in their own right, but we did not include meta-analyses. We did include independent studies that might be of meta-analyses. So that's a lot of screening out, and what we ended up with was over 1,000 that are potentially relevant, and we're in the process of working our way through all of those. And of those that we went through so far, you'll see at the bottom, some of them did not meet standards for rigor, and were coded and are already embodied in our website, and many more are still awaiting our review. Now I'm going to turn it over to Hannah, who's going to talk more about how we developed the content and the methodology we applied.
Thank you, Nancy, and good afternoon, everyone. As Nancy mentioned, there were a number of criteria that we used for deciding whether studies met the content area to fall within the scope of this particular project. Nancy mentioned that studies must be quantitative. We do see value in qualitative research, but as she said, we don't include qualitative research in the What Works Clearinghouse. The study also must look at a population returning from incarceration. For example, studies that examine populations who were sentenced to probation only or who were given various alternatives to incarceration. Those studies are not included in this project. Furthermore, studies have to measure some type of reentry relevant outcomes. They have to look at how populations actually fared after they were released from a correctional institution. And that includes recidivism, employment, substance use, housing, or mental health. For example, we did not look at studies that examined how people fared within the correctional institution itself in terms of administrative actions or disciplinary actions. And finally, we required that studies be published in 1980 or later. We used that cutoff to ensure that the research in the Clearinghouse is more current and applicable to today's societal and reentry context. In terms of the methodological criteria that we used to ensure that the studies in the Clearinghouse are high rigor, we required that studies have either a randomized experimental design in which participants are randomly assigned to either the treatment or a control condition, or we required that they use a quasi-experimental design with either matched groups or statistical controls for pre-existing differences between groups, such as ensuring that the groups were similar on, for example, race, ethnicity, prior criminal history, etc. We also required that studies have a sample size of at least 3 in both the treatment and the control condition, and required that studies be conducted by an independent evaluator, in other words, somebody who did not develop or deliver the program themselves. The alternative to that is if a study was published in a peer-reviewed journal, then we did not require that same independence criterion. As Nancy showed you, we found quite a lot of studies either because they didn't meet our methodological criteria, they weren't rigorous enough, or because they didn't fall within the scope of the study. And a partial list of those ineligible studies is provided on our website. With studies that did meet our criteria and are included on the website, we assigned the studies different types of ratings. The first rating is a rating of the rigor. So all studies that are on the website have to meet at least those basic methodological criteria that I mentioned, but within that subset of studies, we did some of them at a higher level of rigor than that. And those studies have to have the same type of design as the basic rigor studies, in other words, a randomized control trial or a quasi-experimental design that includes some type of matching or controls for differences between groups. However, we did require that they have a larger sample size of at least 100 in each group instead of 30. We also required that they have at least 1 year follow-up period to examine outcomes of participants in the community over time. We required that they have either minor attrition, which is out from the study or the program. And again, like with the basic RIG studies, we require that they be independently evaluated or published in a peer-reviewed journal. Studies, we also assigned outcome ratings, which is for us to synthesize across the different findings in the study and to determine how effective the program that was being evaluated was in terms of improving outcomes or alternatively harming participants in terms of their outcomes. So for each type of outcome that was evaluated in the study, such as recidivism or mental health or substance use, we assigned one of the ratings that you see on your screen. Different types of outcomes could receive different ratings. For example, one study may have received a rating of strong evidence of a beneficial effect on recidivism outcomes, but modest evidence of a beneficial effect on substance use. And we did this because we recognize that different programs may be able to affect participants one way, but not be as effective another way. So studies may have multiple different outcome ratings associated with them depending on how many different outcomes they evaluated. What's on your screen now is a list of the symbols that we developed to use on the website to quickly show people the ratings assigned to each study. We have circular symbols for high rigor studies and diamond symbols for basic rigor studies, and these use different colors to indicate the type of findings that the study found. It's a note that the rigor ratings and the findings or outcome ratings do not influence one another. So, for example, a study could be rated at the high level of rigor but could show no evidence of an effect on any outcomes, or it could be rated at the base level of rigor but show strong evidence of a beneficial effect. I'm going to briefly go over how the website is organized. At the highest level of the website, what you first see when you to the home page is a list of the topic areas. So that includes things like employment or mental health areas. And topic areas each contain a summary that you can read that summarizes all of the interventions and studies within that particular topic area. Click down from the topic areas, you can reach the intervention summaries, and this is where we divide the topic area into various interventions. For example, for employment, it could be work release, it could be job placement or vocational training, etc. And these intervention areas each have their own page which describes all the different studies on that particular intervention. For some interventions, we may have only found one study. For other interventions, we may have found several studies evaluating that intervention. Finally, at the highest level of detail is the actual summaries of the evaluations or the studies themselves. And these are web pages that are found within those intervention summaries, and they describe a particular study, including the methods, limitations, who the study population was, and most importantly, what the study found about the effectiveness of that intervention. Nancy mentioned we're still in the process of going through the massive amount of studies that we found for potential inclusion in the Clearinghouse. The big areas that are currently available for you to look at on our website are employment, housing, mental health, and what we call brand name programs, which are simply programs that are well known and nationally recognized. We are now in the process of developing content in a number of other areas that we will add throughout this year and early into 2013. I'm going to turn it over to Hank to give you a tour of the website.
Thank you very much, Hannah and Nancy. So as you all can see, there is a significant amount of information out in the field on what seems to be working in reentry, and it has taken some really sort of thoughtful conversation and discussion around the best way to get our arms around that information, find out what is most important for policymakers, researchers, practitioners, program administrators, and generally people who are interested in what's happening in the field of reentry. And through the methodology that Dr. Lean and Hannah have designed, we have been able to pick out those key things that we feel most, or at least will be most helpful in understanding the characteristics or quality of a given step, and then what those outcomes are saying and how that ties back into the particular item being evaluated. it was our job at the Justice Center to then translate that into a usable online website effectively, where people can go and come to the site and sort of answer those questions that Nancy posed at the beginning. What do I need to know about the research? Is it reliable? What is it telling me? And how does it relate to the work that I'm doing? As you can see in front of you, this is the front page of the What Works in Reentry Clearinghouse. There are what I like to think of as 3 different points of access to information. This one, as you can see on the left, is the browse the site function. Next one is the advanced search function, and there's also a tips and help box that explains a lot of the methodology that we just discussed now and goes into further detail. We also have a glossary of key terms that you'll need to know, as well as additional information and other sort of tips and help on how to maximize the use of the site. So the things that I was hoping to do in showing you how the site functions is to actually give you a tour of it as someone actually going to the site to find more information about a particular reentry program. One of the things that is one of my interests is the employment field and sort of what employment programs look like and whether or not they're successful and whether or not employment is having an impact on recidivism and how long that lasts and whether or not they're holding a job over time. So often what we hear broadly is having a job improves outcomes, but people still have their questions that I just raised. How do you build an appropriate program? What does that program look like? Are there other programs in the field that I can learn from? And so hopefully this site is going to help some people begin to answer those questions and develop a working program of their own. So to click the employment section of the Browse the Focus areas, that takes me to the employment topic area homepage. As I stated earlier, the topic areas are the highest level of information. So it's on this site where you have the most broad information about what seems to be working or not working, or where there's gaps in the employment field. The link to the tips and help box, so if you're ever unclear about what you're looking at, or if you have questions about why something was included and why something wasn't, you can always click there. All with the sort of understanding that maybe people aren't looking for information about research specifically, but want to know a bit about policy guides or get some of that data information we spoke of earlier. There's a link to other related content that exists all built into the National Reentry Resource Center website. And if you're in a particular focus area, if you want to look for something in particular, you can use the advanced search to begin searching for particular items. Likewise, we've added a key to every, if not almost every page, so that when you are going through the site, you sort of have a feel for that quick snapshot or key takeaways that Hannah had mentioned. So that I wanted to direct your attention to on the focus area or topic area page. As I said before, we provide kind of a broad overview of what's happening in the employment area and how that relates to reentry and why it was included in the site. In addition to that, we also provide a general summary of findings. This summarizes what all of the interventions in this particular area say and some of the trends that we're finding. Just can sort of get a feel for what's happening around research in this area. And finally, on the employment topic area page, we also list out each of the different interventions that fall under the employment area that had research to add to the site. So thinking back to Hannah's slide previously, the list of interventions is essentially that list of sub-interventions that fell under the larger topic area. In the intervention note cards is what we call them. In the intervention note cards, we provide the title of the program or intervention area, a brief description of that intervention, and we also include a rating. Rating is on the top right. Advance the slide quickly. As you can see where the arrow's pointing, we have the rate each of the evaluations within this particular intervention tallied, so you can get a feel for how many evaluations made it into the intervention, what those outcomes were, as well as the rigor ratings. So as you can see from prison industries, there are, I want to say, it looks like there's 7 ones obscured by the arrow. You can see that 4 of them were rated at rigor, and the others were rated at a basic level of rigor, and had significant, so those had modest evidence, and some had no evidence. If you hover your cursor over a rating, such as the arrow on the screen, a little box actually pops up to tell you what that rating actually means. So if you're not looking directly at the key, there's still a way to get to that information. If you end up clicking on a view intervention detail, say you decide that one of these interventions sounds like something that's happening in your community, but perhaps it's not being implemented in a way that makes sense to you, or you're sort of curious about what it says about that particular thing, you would click more or view intervention details to learn more about that particular intervention. One thing I think that we hear about all the time is work release programs and whether or not they're effective, and I think that work release being sort of an interesting program, we have a robust amount of research in that particular intervention, and so I'm going to quickly explore what the evaluation or the intervention page looks like for work release. Once you drive down to the next level, this is the intervention page. This is the second level of detail that provides the research related to this particular area. So again, work release. On this page, we have a table of findings that summarize all of the outcome and rigor ratings for each of the evaluations included. You see that at the top of your page. Again, we have a key and a search box. We provide an introduction to the particular intervention. So this is where you read about what the program design looks like and maybe who's implementing it and sort of what preliminary results are. We have a summary of findings and research quality. This highlights sort of what the research is like in this particular area and sort of what the trends are and what some of the particular studies begin to suggest. And then two things that I think are of particular importance and interest to folks in the field are recommendations for practice and suggestions for future research. As you can see, I've put a red box around recommendations for practice, and I think what's really unique about this is that as expert researchers at the Urban Institute are going through all of the information, whenever they come across a particular recommendation for practice, or if a researcher makes a note about suggestions for future research, Hannah and Dr. Levine and their team will pull this out and make sure it gets placed on the site. Down on that page, similar to what we saw on the topic area page, we have a list of the evaluations that are contained within that particular intervention. This gives sort of a quick snapshot as to the different evaluations that make up that intervention area. In this particular example, there is a list of 6 evaluations that each sought to evaluate work release programs. As you imagine, these are called the evaluation note cards, just as they were called intervention note cards on the last page. These evaluation note cards function in much the same way. They provide sort of a snapshot overview of that particular program that was evaluated and give a bit of information to help communicate, is this related to the work that I'm doing? What does the study say about this particular program? Is it a rigorous or reliable study? And is it sort of worth my time to explore more? So then, in addition to the program name and rigor ratings and outcomes, we do provide information on the program, the target population, demographics of the folks who participated, and a brief description of the setting. If I click on the title bar of one of these evaluation note cards, they expand to reveal additional information. And so you can sort of get more information about something without actually having to go through the bulk of the research. When you expand an evaluation note card, it's more explicit about what the findings say, the information on the limitations of the study, and we provide other sort of relevant and helpful information. Once I click, if I decide to say that that particular program sounds interesting and I want to learn more about it, I can click View More Evaluation Details, and that takes me to the core of the site. This is sort of the founding or the fundamental level where all of the information is kept, and so this is where you find the most detail that is otherwise summarized up and represented on those higher level pages. This page that you get specifically the outcome ratings for this particular program. You also get a summary of the program, a description of the target population. In some cases, this is detailed information. It includes things such as the types of crimes that people were convicted of, or how long their incarceration was. Other times it can be just demographical information that's specific. There's a discussion on the methodology and the limitations of the study, and an overview of the findings, and of course the publications that we reviewed in creating this evaluation page. Scroll down on this page, we provide much of additional information that I noted. One thing that is important to know is that we can't necessarily distribute a lot of the publications that we review and post online for obvious reasons. We don't have the rights to them, or you have to pay a publication to access them, and so we do best to make sure that you have access to as much of the most important information as possible. So we do know where we received a particular publication from. If you see something you're interested in and have more questions that we necessarily didn't answer off the bat, you can find information. So if someone has sort of gone top to bottom through a section and they know, have a good feel for what seems to be working in a particular area, and they like what they've seen so far, but maybe they're looking for something specific, they would come to our advanced search page. When you click on the advanced search pages, you're brought to the screen you currently see in front of you. You can search by keyword, but also apply other criteria to your search to narrow down your results. Is just a select number of criteria, such as focus area, rigor level, some demographical information about the target population and the setting in which the program was implemented. But as we increase the number of studies that are on the site, and the more information we add, then we can start adding more and more selection or search criteria. You're able to sort your findings according to outcome or rigor level, and hopefully this makes it a pretty easy to use tool that will hopefully answer some of your questions about what seems to be working in the field of reentry. So that, I think I'm going to pass it over to Hannah, who's now going to talk a bit about some of the preliminary findings that we've seen with this project thus far.
Hank, I'm just go over some of the very basic findings. Of course, you can find more detail and the actual ratings for each program on our website if you're interested after this webinar. The thing that we noticed as a sort of a trend is that comprehensive aftercare programs tended to be effective according to most studies of these types of programs. That includes 4 out of the 5 comprehensive aftercare programs for mentally ill individuals that we evaluated, 6 out of the 7 comprehensive brand name or well-known programs that we looked at. We also found that 5 out of the 6 community-based aftercare programs for substance abusers that we examined also found positive effects for those programs. That information is not yet on the website. I'll go over it in a minute. We plan to roll out the substance abuse topic area within the next few weeks. We found for employment programs some mixed findings. We found that for both work release and prison industries, which are the 2 largest intervention areas under employment that we found, about half of the studies actually found effectiveness for those programs, which seems to suggest that the effectiveness of such programs could depend on different contextual factors. However, it's difficult for us to say anything about what those contextual factors might be, since that information was not necessarily provided in the studies that we evaluated. So at this point, it's difficult to say what might make one work release program effective and another work release program less effective. Unique employment programs or employment programs that provided a variety of services and a unique program model that they used. We found several that showed no effects on participant outcomes, which was in contrast to a couple of other programs that we did find some effects. So again, it seems that there are certain contextual factors that influence whether these types of employment programs actually help improve reentry outcomes, such as recidivism, which is the main outcome that these studies examined. We found a few studies that did show that the effects of different types of programs depended upon individual characteristics such as risk to recidivate or the point at which the service was delivered to the person in terms of right after release versus later while they were in the community. We found that only a few studies actually examine these factors, though, so that is definitely an area for future research to look at whether those factors are shown to be important across a variety of different types of programs. Probably the biggest and most frustrating finding of this project was that we found few studies that were actually eligible for inclusion in many areas. We culled through a wide variety of literature, but we found that either due to methodological problems or issues with the content of the study, that they didn't meet inclusion criteria. For example, we did not find any eligible studies in the physical health topic area despite a thorough search, and we also found only 3 studies in the housing topic area, all of which concerned halfway houses. I found that the main reason for this was that there is a limited number of studies actually looking at post-release outcomes of people leaving prison or jail who have participated in these types of programs. We also found that many studies did not meet our level of methodological rigor, despite this being our basic level being relatively not as strict as you might think. We don't require, for example, random assignment. We only require that it be a quasi-experimental design with some type of matching or controls for differences between groups, and yet many of the studies that are out there fail to meet that basic standard, which indicates, of course, that more research and more rigorous research is definitely needed in certain topic areas. And finally, to discuss briefly our next steps, we at the Urban Institute are continuing to work with CSG in developing additional content, which will be posted to the website later this summer and fall, and also into early 2013. As I mentioned, we have, as you can see, a number of topic areas that are first on the list for rolling out, the first one being substance abuse. As I said, we hope to have that one up very soon. And we hope to have all of our content done by early next year. You can see the contact information for all of us as the presenters. Feel free to email or contact any of us with any questions that you may have. And thank you for being with us today, and I guess now I'll turn it back over to Hank for the question and answer session.
Great. Hannah, thanks so much for discussing those preliminary findings. I have a few questions that come up that I think would be pretty interesting for the group to hear. I know that Nancy has taken a stab at answering some of these as they come along, but I think that they may be helpful for other folks to hear answers to. The first one is, Hannah, Dr. Levine, if you could, can you please speak a bit about why meta-analyses are not included in the site?
Hi, yes, it's so probably it's best to start with a definition of a meta-analysis for the audience. Meta-analyses combine findings across evaluation studies, way make of the samples, sample sizes, the effect sizes, the standard deviations, a lot of the statistics behind those findings, and then do a kind of combined analysis across the studies. So the results of that analyses we found didn't lend themselves to our project because we were not able to determine which studies that were included in any one meta-analysis were rigorous enough to include. So if we were to just take those findings and run with them, we have confidence that all the findings embodied by the individual studies were of individual studies that were rigorous enough to meet our threshold. So instead of taking entire meta-analysis results and including them in the clearinghouse, we used the analyses to identify the individual studies and went back to those original studies to assess them for rigor and include them in the clearinghouse in that manner.
Great. One other question that came up that I think is interesting is the idea that if our multiple different studies or evaluations of a particular program and the results seem to align, but there is some difference in the findings, how reflected in the rating system. I was asked if sort of evaluations are ranked in a way. I think this might actually be a question for Hannah to talk a bit about how determination on our rating is actually determined or assigned.
Sure. The process for determining the rating is a multi-stage process. We first have someone from our team of coders look through the study, read it thoroughly, and record some information on it in a coding sheet, and then also write a summary of the study and assign preliminary ratings, including both the rigor of the study and the outcome ratings. We then have the study reviewed by a senior reviewer on our team. That's somebody at the PhD level who reviews the summary that the editor has written and also the study itself and determines what they think the rate should be. If there's a discrepancy, then the coder and the senior reviewer will discuss what they think the rating should be and will arrive at a final determination. Can't reach a determination, then that decision goes to Nancy for the final say. Does that answer the question?
Yes, I believe so. The questions that I think it may be easy to sort of for me to address off that here. Folks have been asking about whether or not findings in these studies be applied to different kinds of programs, such as programs that operate sort of in the faith-based realm or as a community organization, not necessarily a program that was run by a corrections or community supervision agency. And I think that the answer is that site is meant to provide a snapshot of strategies, programs, and program components that seem to be working, and there's no reason to suspect necessarily that the research that we've come across doesn't apply to different settings in that regard. I think that if a faith program was interested in implementing a program that employed something that we've discussed under employment, then I think it would probably be a workable program model as long as you're partnering with the right folks and you've sort of got the right research and you're sort of adhering to what other sort of policy and practice guides suggest is what works. There was a question about, or a few questions about sort of auxiliary projects that relate to the clearinghouse, such as a social forum or the ability to download and run reports, or to cull other important information from the site. A lot of these are forthcoming or ideas that we have, but we're still sort of in the initial phases of building out the content. I think that once we have the content built out, the opportunity to build things like a forum or the ability to run reports will become available. One of the things we also hope to do is start developing reports that we are based on our findings that very much reflect the kinds of things that Hannah spoke about at the end of our presentation that talk about sort of the themes of what seems to be working in a particular focus area. Someone asked the question how this may relate to risk need responsivity principles and some of the other sort of practices or guiding principles being implemented at large in the reentry field, and we hope to sort of extract those key themes and help develop policy documents or research summaries that allude to that. And I know specifically on the urban end of things, they're interested in this approach to identifying gaps in the research field and where researchers can not only improve the work that they're doing, but also focus in on specific topic areas or program components that have yet to receive a lot of attention. One question that I received that I think for you to answer, Nancy, is whether or not the public can influence the priority of future categories and sort of how people can provide feedback and sort of help guide the work that's being done in this area.
Well, certainly we're interested in hearing what our users believe would be most helpful to them and in the way we structure the website and how it's populated. With regard to prioritizing certain categories over others, it's really a matter of the volume of studies per category and our efforts to get through that volume of research. So, for example, someone suggested that substance abuse should be a priority, and we agree. I mean, this is a huge need that really affects this population. But there are just so many studies under substance abuse, so we're working our way through them. But our strategy is to roll out categories as they are completed, rather than posting some but not all of what we know about substance abuse programs, to finish that entire category and then post it as a group. But we're welcome to all input. I mean, that's one of the reasons why we're having this webinar. So,
in a similar vein, someone asked about unpublished program reviews, and those will be or can be included in the database.
That question, we include all the unpublished research that we can find that does meet our criteria. So, for example, we do have several doctoral dissertations, for example, currently on the website or under consideration. We have not at this time a process of actually reaching out to researchers and asking them what studies they may have conducted that have not been published, but we have done an extensive internet search using several venues to try to bring up both published and unpublished material.
I have a few questions about where people can get additional information on programs or strategies that don't necessarily fall under the direct purview of this project. I think it would be quickly, I have one answer and maybe a good question for Hannah, but the question essentially is where can I learn more about similar programs that maybe aren't reentry programs, so institutional-based programs or programs that aren't explicitly reentry programs like ours. The first place I would recommend going is another effort called Crime Solutions, which is also coordinated by the Department of Justice, and the difference between Crime Solutions and what's in Reentry Clearinghouse is that the Crime Solutions site is sort of spanning reduction programs. It's not strictly looking at just reentry programs, and so it provides a lot more sort of breadth in the field of crime reduction, but doesn't necessarily provide the same sort of depth in one particular focus area, such as what we've done. So there are many complementary efforts, what works in Reentry Clearinghouse and the Crime Solutions site, yet the Crime Solutions effort, crimesolutions.gov, provides information on programs and strategies used in settings other than the reentry setting. How many other sort of key databases that come to mind when you're thinking about databases that provide information on crime reduction strategies or different kinds of reentry or other diversion efforts or anything like that?
Well, honestly, I think probably the best place to go is the National Reentry Resource Center itself, which of course has lots of information about different types of programs that's not necessarily included in the What Works component of the website. So you should be able to find a lot of information there as well.
Okay. Let's see here. I'm getting questions. Thank you, guys. I'm trying to consult where possible. So a question about sort of reconciling the differences between mixed results. You asked Dr. Levine if a particular intervention has mixed results, say, two high-rigor studies, and maybe one with significant findings in reduction, and one maybe has significant findings in another, or sort of two rigor studies with no significant effects, and some basic rigor studies with mixed effects. As a researcher who's sort of looking at this information and then thinking about how it applies to practice, do you sort of tips or hints on sort of what to think about when you're going through information like that?
Right. When we originally set up the methodology for this clearinghouse, we anticipated that we'd have such a volume of studies per intervention category that we could have a pretty complex numerical system that would with high rigor studies, the findings of high rigor studies higher than the findings of rigor studies, or I should say adequate rigor studies, and so forth. We were really thinking about it in quantitative terms, and what ended up happening was we discovered that there really aren't a lot of individual evaluative studies that meet our threshold of rigor that would lend themselves to that kind of a rating approach. So what we end up doing is kind of talking through it. When we look at findings, when something is effective, we don't just say, okay, it's effective or it's of an effect. We look at the underlying statistical analyses that yielded that effectiveness. So in any given study, we'll have many statistical tests on outcomes of interest, both recidivism and other outcomes like employment and refraining from substance use. And so we look at each and every statistical test and see what balance of those are effective or statistically significant in the expected direction, and what balance of those are not, including what error may yield negative, harmful effects, and kind of do assessment and talk through what the overall results of those statistical tests are. And then that is just to identify the effectiveness of any given one intervention or program area, and then we bubble it up, combining and synthesizing across others to determine overall, what seems to be look effective and rigorous. So that's a really long answer to say it depends. It's hard to give you a single answer because the context behind each one of these is different based on the composition of the individual studies that populate it. But it's certainly true that you should look at results in light of both the body of evidence in terms of what found to be effective, as well as the level of rigor of each evaluation study.
Great. I have a few questions about the process for updating and learning about new topic areas as they are released. Essentially, the process is fairly straightforward, as much as the actual work behind the scenes is not. As new publications are identified and screened and coded and reviewed and synthesized by hardworking researchers over at the Institute, they sort of grow that data of information until they've reached the benchmark for that particular focus area. And that information is passed along to us at the National Reentry Resource Center. And then with a handful of staff here, we work to make sure that is integrated online. We had mentioned it earlier on, we want to make sure that sections are put up as complete as possible and that they're not partially completed and key information is missing. And so each time that we put up a new section from here on out, we will be sending out announcements through our subscriber email list. So if you subscribe to our newsletter or if you receive our announcements, you can expect a special announcement anytime we add a new section to the site. In addition to adding that new section, we hope to provide a bit of information about content that we've included and perhaps some other interesting stuff for you to look into. So certainly sign up for the National Reentry Resource Center newsletter, and you will be kept updated as stuff arrives. I've also received a few questions about the state of research. The first one is, are there any particular areas in which research seems to be lacking? Someone specifically asked about in working with females. And then the next question was, as we begin to develop suggestions for future research, is it the hope that these guide sort of federal investments into program evaluation or private investments into evaluation? Thinking, Nancy, do you want to talk about sort of what you've seen in terms of gaps in research?
I can take the question about in terms of the female offenders. I actually, back in, I believe it was March, participated in a panel at a conference here in D.C., particularly about women in reentry, and discussed the general lack of studies that we've been able to identify specifically on female offender populations for this project. Unfortunately, many areas of research are heavily geared toward looking at male participants and how their outcomes fare. I would say that we seem to see a special lack of studies focused on female offenders in the area of employment programs. Those are often entirely male populations. We see some more female-focused research in the areas of mental health and substance abuse, although there's still definitely a research gap in that area.
If I could just add to that, Hannah, one of the reasons for the dearth of research on women is because the population sizes tend to be fairly low. So there's a lot of good qualitative studies on women, their challenges, their experiences in programs, and the results of those program experiences on their outcomes. They just don't lend themselves to this specific methodology that we've employed with the Clearinghouse because they're not empirical.
Great. There's a question about how I can learn about the studies that did not make it into the Clearinghouse. And there should be a downloadable link on the page that allows you to look at the studies that were reviewed initially, but then either failed to meet the standards or qualitative or didn't meet some of the other content-related criteria. Question about the way sort of findings are displayed. It's whether or not we that focus on medium or high risk for recidivism and how those programs fare. I think what is we've taken a look at all of the research in a particular area as it relates to recidivism, and in our findings section, anytime there seems to be a difference between subgroups, between perhaps a low-risk subgroup and a high-risk subgroup, or a subgroup that was enrolled immediately upon release or a few months after release, if the research initially took the time to identify and as differences between those two subgroups, that's discussed in our findings section. Hannah had earlier that what we've seen, at least preliminarily, is that evaluations that have identified high-risk subgroups, those groups have tended to do better with effective reentry programming. But you know, sort of make sweeping conclusions out of the gate like this. Thing to add, Hannah, around the way you guys handle sort of different subgroup analyses?
I think that we tend to include any useful subgroup analyses or subgroup analyses that we think are important in both the intervention summary pages and the evaluation summary pages. So that information should be provided on the website.
There are a few questions about racism-related outcomes or impacts on the community or someone or individuals and sort of what their reentry process is like. Because we're looking at studies that use quantitative analysis to determine the impact of a particular program or strategy, those more sort of qualitative or publications that describe sort of the process and impact or the experience of reentry are included in the other resources link. So if you're on a particular topic area and you want to learn more about any employment-related application and what impact that may have in like an economic sense or what it means for community stability, there's some information on the site that touches on that. But if it's not a program that's being evaluated, then it probably won't be included on the site. So I have a few questions about timeline and next steps. So Hannah, do you think I should back up to that schedule just so everyone can see quickly what that looks like?
Sure.
Okay, great. So for those who are interested in the rough rollout timeline for how we hope to get content added, this is sort of the way in which we've structured it or identified a primary need in the field. Whether or not we have a comprehensive list of all studies reviewed, whether or not they made it online. I do know that there is a master list of all of this information, although it would take some cleaning up and some playing with in order to make it sort of publicly ready. And I think Nancy and Hannah and I will have to discuss that a bit before that goes live on the site.
You'll search by evaluations. So from the homepage, if you want to follow the evaluations, you can go to Advanced Search and search by evaluation. And if you don't check any of the boxes, then you can bring up a list of all of the evaluations that are.
Yep.
Not only include the ones that were eligible. Sorry, not the ineligible studies. Those are separately.
There is a question that we may not have answered directly about the suggestions for future research or what we hope people to do in the future when reviewing this information. I think that whether it's one particular program or if it's a State Department of Corrections or if it's a foundation that's funding research, we encourage all people working in reentry and sort of working with programs to find ways to try and evaluate sort of what their program's doing. The best way that someone can implement an effective program is by knowing what their program's doing and adjust accordingly. The Clearinghouse provides a lot of great information on strategies that have worked, but you really don't know what's happening until you have sort of measured what you've done and measure the impact in the community. So I think sort of like a broad takeaway, I don't think we're trying to drive one particular part of the field in any direction as much as we're trying to encourage all people to be cognizant of and thinking of, whether or not what their aligns with what seems to be working and is measurable or measurable impact. Let's see. I think that it looks like we have addressed a lot of the questions that folks have. Hannah and Nancy, are there any sort of other outstanding topics that you guys wanted to touch base on?
No, I did see a question here, Hank, asking whether the evaluations that are included in the clearinghouse distinguish between low, medium, and high-risk individuals. And I can say that, yes, several of the studies do. Not all of them make that distinction. And when that distinction is made and we find different outcomes based on risk level, we're sure to report those in the evaluation summaries.
And that actually reminds me of another question I saw that I don't think was asking this specifically, but was alluding to something like this. But we thought about the importance of using risk assessment and applying the risk need responsivity principles. Nancy or Hannah, Dr. Levine or Hannah, do you think you could quickly discuss why evaluation of risk assessment may not be necessarily included in the site?
Well, I think the easy answer to that is that risk assessment tools are designed to facilitate the how a particular organization or agency allocates different resources. For example, they may be more interested in allocating programming towards higher risk clients, or assessment instruments can be designed to facilitate the referral process. For example, seeing that an offender appears to have high need for certain type of programming and referring that individual to a program. It doesn't in itself actually address reentry needs, but it's a process for trying to assign and allocate reentry programming to the appropriate people. So for that reason, we would expect someone receiving a risk or assessment instrument alone to have reduced recidivism or improved outcomes. On that, we would expect the actual programming or services that they receive to be the reason for improved outcomes. So we can't really rate the effectiveness of an instrument by itself in terms of improving outcomes. But certainly would rate that as part of a holistic process that involved and assessing individuals and then assigning them to programming. Great.
It looks like I have one final question, and I think we're going to wrap things up. And it's asking about the statistical requirements for an evaluation or sort of that key information about the methodology. All information regarding the methodology of a particular evaluation is included variously throughout the site, but the bulk of it is in that evaluation page summary. So if you are looking at an evaluation and you're wondering what alpha level was used or the different sort of level of effectiveness and statistical power and that sorts of information, most of that should be included in the evaluation summary. So this concludes our webinar. After you exit, a brief survey will appear on the screen. Answering the questions in the survey, you will be helping us improve on the services that we offer, and so we greatly appreciate it if you would take just a few quick minutes to complete that survey. We'll email a link to the recording of this presentation, as well as a link to the PDF of the slides that we used next week. Also be made available on the National Reentry Resource Center website, www.nationalreentryresourcecenter.org. Thank you all very much, and have a great afternoon.